I will turn it over to John Fox, who's going to kick things off for us this morning.
Thank you, Jerry, and thank you all for joining us this morning. As Jerry indicated, we're dealing with a very, very serious situation. For Beaumont, we have 9 ERs and 25 urgent care centers. Our volumes are all way up, particularly with testing volume. As Jerry indicated, the positivity rate is up substantially. That means that we in our communities are transmitting the virus much faster between each other than we were 30, 60, 90 days ago. And it's accelerating. It's an accelerating trend. It's very serious. In terms of our inpatient volumes, which is a lagging indicator, and you got to watch out for that one. The virus is, that tells you how much the virus spread 2 weeks ago rather than, the current situation. Our inpatient volume has now tripled with COVID-19 in less than 30 days. We are now over 400 across our 8 hospitals with COVID patients. And again, that is accelerating. I will tell you that one of the most difficult things is getting people to use the basic tools of infection control that will protect people from the virus, particularly a mask. It's a difficult situation. People do not appreciate. We see it out in the community. We see it in our own lobbies. As people come in, we ask them to wear masks to do the basic protective activity, and we get resistance. We have to work that through. And again, this is a controllable pathogen if we do the basic infection control steps of masking, social distancing, and hand hygiene as your big 3, and we can turn this around. But at the current rate, it's not turning, and it could be a much more serious situation. So with that, I'll probably turn this over to Tina Fries-Decker. Thank you.
Thank you, John. And again, thank you all for joining us today. I want to start first with just my gratefulness for our physicians, our nurses, and caregivers who are working tirelessly in our hospitals and our healthcare facilities to care for the communities that we all serve. And so we thank them so much. What we are trying to do is continue to slow the spread and flatten the curve so that we can continue to care for patients and people within our community, not just COVID-19, but for every healthcare situation. What we are seeing is very similar to what John Fox said. We do about 4,000 tests a day, and it's about 15% positivity rate. Just 2 months ago in September, it was at 3%. So it's a much different situation than we had a couple months ago. We're also seeing that this is throughout the state. And so that's a concerning piece because that's much different than it was in the spring. But one of the good news is that we aren't seeing the demographic disparity that we did see in the spring. It is infecting all populations. And so that's why it's critical for us to come together as communities to practice the things we know that work, but also limit the in-person gatherings so that we can flatten this curve and continue to care for our communities. And now I'll turn it over to Wright Lassiter.
Wright, are you on? It's over to you.
Thank you. My apologies. Good morning, Wright Lassiter, Henry Ford Health System. The story is the same at Henry Ford, as you've heard from my colleagues at Beaumont and at Spectrum. In the last 14 days, our COVID admissions have risen by 128%. And so we're seeing significant escalation across all of our Southeast Michigan hospitals and our Central Michigan hospitals. We have a significant burden in our emergency departments, as you heard from John Fox. Similar to the story that you just heard from Tina in Grand Rapids, the positivity rate for patients being tested in Henry Ford laboratories has risen extensively. As of this morning, it was 16.4%. Not unlike what you heard from Tina Fries-Decker, just weeks ago, it was in the low single digits. And so it's very, very clear that we're seeing something different. We're seeing a significant escalation in the community spread of COVID-19 across all portions of Michigan, as you'll hear today. I would say to you, as you've heard from our colleagues, while there's no silver bullet for COVID-19, we clearly know that some things work. We clearly know that wearing masks works. We clearly know that social distancing helps. We clearly know that hand hygiene helps you remove pathogens from your hands. And we clearly know that removing yourself from large gatherings where the spread is possible will help. We're here this morning asking all Michiganders to support our essential workers in healthcare with the kinds of practices that will help us help you. But lastly, just say that Henry Ford Health System was one of those systems hit very, very hard in the spring. At our peak, we had 1,000 plus patients across our system. And so while today isn't like that, there's one significant difference that I do want all Michiganders to understand, and that is, we've been in a battle for the last 8 months. And when you're in a battle for that long, you lose a bit of energy, steam, and resiliency. I would tell you that the amazing physicians, nurses, and other healthcare workers, essential workers that work in our healthcare systems are working tirelessly on behalf of the state of Michigan on a day-to-day basis. I ask you to help them in not having to have the volumes return as they were this spring. Thank you very much. And I'll now turn to Ed Ness from Munson Health.
Thank you. One of the I would say the statistics in northern Michigan and Traverse City in northern Michigan are very similar to what you see or heard in other parts of the state. We have seen our percent positivity rate almost triple over the last 4 weeks, and our census at our community hospitals go up by almost 4 times. What is different than back in March and April, where this was a situation that was really focused in the Detroit and urban areas, it is now throughout the state. And we are seeing the same spikes that we're seeing in our urban areas. I think and because it was isolated before, I think some of our rural communities felt that they're isolated, that they're protected from this issue. And our recent data has shown that it doesn't matter where you live, we are facing the same situation. And so one of our messages to northern Michigan is, even in our rural communities, you have to be diligent, you have to wear masks, and you have to be cognizant of limiting the size of social gatherings. One of the other things I think that is unique about our rural communities is the lack of safety valve. It is 2.5 hours from Traverse City to Grand Rapids, which is the next biggest system. And that's quite a burden for families for transfer of patients and for care. So really the same messages as we see outbreaks in the Upper Peninsula, put pressure on our downstate hospitals. It is now more than ever a time for our communities and our citizens, whether that's in the rural area or in the metro area, to really take precautions so we can bend the curve. As you know, in smaller hospitals, they are the only hospital in a community. So there isn't safety valves. And so we really need to be cognizant to bend this curve to protect our staff and to protect our community. So thank you.